30% of dog lovers believe that their pooch gives them more unconditional love than anyone else in their family, including children. And treasured by her family is 11-year-old Lottie.
What are you after?
A Daschund-Chihuahua cross.
Come here, lads. We inherited Lottie a couple of years ago.
Oh, Lottie.
She came from Serbia through Romania to the UK.
Always hungry, aren't you?
We know that she had distemper, so she was quite ill when she came across. She's lost an ear at some point, we're not quite sure where.
She's very sweet, loving.
What's going on?
We're both quite anxious people, so I originally thought it would help my anxiety, but then realising she was also very anxious, we kind of sit through it together, and that can also be so reassuring.
Lottie is certainly a welcome addition to the family, but she does have a naughty streak.
Lottie likes to eat everything, so she's always sniffing, always looking, so you're always thinking, my goodness, what's she eating now? Where's it at? Both my wife and I were at work. Archie, our son, sent a message that I think Lottie has eaten grapes. He knew they were quite bad. And I mean, Archie's never walked the dog in his life. And the fact that he walked her to the vets meant that he obviously knew that they were bad, and because he loves her so much, wanted to get to the vet as quick as possible.
Thanks to 16-year-old Archie's quick thinking, Lottie is now getting urgent medical attention from vet Amy and deputy head vet nurse Beth.
I would say as soon as you know that your dog's eaten something that's possibly toxic, to ring the vets. So the sooner the better, really.
It's the tartaric acid in grapes that makes them toxic, and it could cause kidney failure. Amy needs to get it out of Lottie's system straight away, so she's given her some meds to make her sick.
So it can be quite variable how long it takes them to be sick, but sometimes it's quite quick, within a few minutes, and other times it can take up to kind of 20 minutes.
Good girl, that's all right. Oh. Oh, Lottie. Oh, there we go. Okay.
Oh yeah, there's a raisin or a grape.
Unexpected vet visits can come with unexpected bills. But thankfully, emergencies like Lottie's are usually covered by pet insurance.
So we've got her bloods to run. We'll check those again in 3 days' time. Hopefully there'll be no change in her kidney function, in which case, job done. Hey, you ready to go home? Stay away from those grapes, hey?
Our cats are living longer than ever before due to better care and veterinary treatments. The average life expectancy is now around 11 years of age, and some kitties even reach their 20s.
Yeah, Mum.
Our next patient, and classed as a geriatric, is 16-year-old Daisy, who's here with her owner, Richard.
Hello.
Daisy is booked in for an abdominal ultrasound, a common procedure when suffering from an overactive thyroid, which can affect the kidneys.
When did she last eat?
Yesterday afternoon, and she's not happy about it, as you can probably tell.
Before the scan can go ahead, veterinary nurse Georgia needs to check some essentials.
So I just got a consent form to go through, if that's
Yes,
all right.
of course.
Is she insured by any chance?
She is, yes.
Who are you insured with?
Petplan.
Lovely. You stay there.
Come on, you go back in there now.
Oh, good girl.
In you go. It's amazing how willing they are to go back in the box, isn't it, when they're here?
Yeah, I do struggle to get her in the home.
Overseeing Daisy's ultrasound is vet Amy, nurse Georgia, and I'm on hand in case a paw needs holding.
I saw her last week because her owner was just wanting to check that Daisy was well. She'd lost a little bit of weight, so we ran some bloods, and that showed that she had an overactive thyroid gland.
Aww.
I also discovered when I examined her that she has a heart murmur, and I could actually only feel one of her kidneys. So the point of today is to do a little ultrasound scan just to see if we can find that other kidney. But I just need to make sure that she's got both kidneys before we start thinking about some treatment.
Well, if she's got this far with only one, presumably that's not
hopefully
so bad.
positive, yeah. It's just that when we start treating hypothyroidism, that can sometimes unmask some kidney problems before we do
Why
that.
does hypothyroidism start?
So it's a little benign tumour of the thyroid that means that the thyroid gland produces too much thyroid hormone, but we don't know what triggers that. So we'll have her lying on her side.
She's very long.
Hopefully she'll be compliant. We just have to clip the fur away.
Investigating all sorts of different things is
Yeah, we do.
interesting here, isn't it? You don't know what you're going to find or what is missing.
That's true,
Yes.
yeah.
She hasn't been sedated, has she? She's just
No, not so far.
putting up with this.
Good girl.
It's okay. I know. It's very undignified for a lady, but you're surrounded by ladies. Don't look at these other people.
Ultrasound is a non-invasive diagnostic tool that allows Amy to examine internal organs and soft tissue. It has high-frequency sound waves to create real-time images.
So this is one kidney here.
Yeah. I don't know how you can tell that.
So it's just the shape and structure of it, really. So this is enlarged and not a normal architecture of the kidney.
Amy has located the left kidney, but is struggling to find the other. So she decides to flip Daisy over.
There we go, there it is. So that's the second kidney, so she has got both kidneys, but it's very small and very abnormal. So I think what I'd like to do is speak to a specialist, because I think this is probably a non-functional kidney, and then to have a better look at the enlarged kidney.
Poor little pussycat.
So it might be that if we treat her overactive thyroid gland and bring her thyroid hormone down, her blood pressure might lower. So it might be that the heart murmur resolves itself.
We're getting through. We solved the mystery of the missing kidney.
Tucked away under a rib.
Yeah. And now we've just got to get you looking perfect.
Our next patient is 14-year-old Springadoodle Coco. She's booked in for a wart removal with vet James and head nurse Ella.
That is very whiffy, isn't it?
Before they proceed, Coco is having pre-meds to keep her nice and calm.
The main reason we're removing it today is because it keeps getting infected. It's basically getting to the point where it's affecting Coco's quality of life. Good girl.
It's not a good day to feel squeamish, is it?
No. So Coco is one of our geriatric patients. She's 14 years old, which for her breed is a really good age. It does sort of change the parameters maybe a little bit. So we're not going to be sending the lump off for histology. We're not worried about what this lump is as such. We're not going to do any further treatment than just make her more comfortable, which is to physically get rid of this nasty lump on her back. So you just got to be a little bit brutal to just get these scabs dissolved. Underneath all this sort of crud and build-up, the wart itself isn't quite as big, but the problem is they do grow. There's not much in veterinary that turns my stomach, but smells, unfortunately, I don't go particularly well with. But you just got to focus out and keep moving. Remember your training. Oh, God, honestly.
Before James can surgically remove the wart, he needs to clean the surrounding area with an antiseptic solution.
So what this is, it's very likely the type of wart which is linked to a virus called the papillomavirus. So sometimes it's linked to a virus, sometimes it's not, sometimes they just get them as part of aging. Gruesome as it is now, it's also really, really satisfying to get it properly cleaned up. So you can see how that's just oozing blood. That's not because we've messed about with it, that's just what these warts do. Just deep breaths.
14-year-old Coco is now prepped and ready for her wart removal surgery with James and Nurse Ella.
It's going to be very bloody. It's right up in the scruff, which is particularly sort of vascular area, which is why it's quite bloody now, but once we've got on top of that, it'll come together really nicely. So, can I just have a few more swabs, please?
Of course you can.
Procedures like this one should be straightforward, taking no longer than 30 minutes. With the wart removed, James can now close up the cavity.
We're just wondering whether we get the diathermy on it so we can electrocauterize it rather than lots of little stitches. So this just helps to seal off these tiny little vessels, which otherwise can just keep bleeding. Okay, right, I'm happy that nothing's bleeding there. She's gonna have a bit of a funny hairdo for a while, isn't she? And her little bald head.
James is now using nylon similar to fishing line to stitch up the area. It adds extra scaffolding, and they'll need to be taken out in a week's time.
So because where this is, right on her scruff, I'm going to put these extra layer of stitches in as well. What I don't want to do is if she rubs her back or gets her back foot and tries to give it a scratch, I don't want her to open up these stitches. So it just gives it a bit of extra strength. Right, last stitch and we're done. Oh, look at her. Love her. I have a bit of a soft spot for the older dogs, to be honest.
Yeah.
There's something about caring for an older animal which I think is hard work. It's like a puppy, you know, it's the very old and the very young that need the most attention, but I think it's a real privilege to be able to look after an older dog in its older age. Oh, hello you. Welcome back, hey. Oh, that was nice. She's woken up nice and steadily, hasn't she? Yeah. Good. Get you back into your bed and then the nurses can continue to monitor her through and then hopefully she can go home later on. Good girl. Okay, good girl. Oh, hello.
Oh.
Hello, darling. Hi. Right, let's go this way.
Okay, be brave. Be brave.
Fern Britton Inside the Vets, brought to you by Petplan.